you before we start. And here is how we evidence the fracture of the crown and how that keeps going into the root. And important is that even if we have a CT scan or even if we have a periapical X-ray, and we know that there is a defect, it is important at the moment of the surgery to sound within the alveolus and post-extraction socket. I'm able to give a little bit more movement of the tooth, fresh extraction socket, palatal socket. And I'm using that palatal socket because I'm able as well to follow deep enough, as you can see. And this is a very easy way to place an implant in the presence of, in the absence of buccal bone, because I still have the presence of that interradicular bones, premolar. So I'm using that drilling hole that I just did out of the socket that I basically, what I did was follow, because I have to regenerate a lot. So the best way to do it is by, as you can see, is by tunneling the most apical aspect, fixating the pericardium membrane below that periosteum that will warranty of silicone sleeve that is transparent, that I can actually position over my implant and have an isolated, completely isolated particulated bone. Because now I'm going to refill with flowable composite and I don't want to have contact with any particles or anything that is below that area. So that also, since it's transparent, will give me the exact shape of the gingival margin and the emergence profile of my future customized healing abutment. So everything that goes inside the mouth of the patient to hypochlorous acid to decontaminate it. One of the best disinfectants that you have of your customized healing abutment. And that's the final result of the case.